Very good morning to everyone. Today's topic on recent advances in periodontal surgical therapy. Introduction, background rationally, minimally invasive and microsurgical approaches, biologic like PRF, recombinant growth factors, EMD, biomaterials and membrane like guided tissue regeneration, guided bone regeneration innovation, laser, digital workflow, other technologies, clinical evidence, tips and references. Goal, restore form and functions, regenerate the lost periodontal tissues. It shift towards preservation, minimally invasive and biological enhanced technique. Emphasis on patient-centered outcome, pain, aesthetic and morbidity. Minimally invasive microsurgicals like mist and modified mist for infra-bony defects, smaller flaps, improved wound stability. Microsurgical instruments, magnifications and finer suture improve flap adaptation and patient comfort. Clinical trials and systematic review supports comparable or improved outcomes versus conventional flaps. Another one important one is platelet concentrations, PRF and derivatives. PRF like IPRF, LPRF, APRF, TPRF, where study shows improves in clinical attachment and bone filling infra-bony defects when used with grafts. Protocols continue to standardize centrifugation and handling for predictable results. So can you see this diagram? This is the upper yellow code part and red part which where the PRF is presented. We can show that the regeneration, PRF will act as a regeneration, it acts as a scaffolds for growth and regenerations. So you can use in implants, infra-bony defect and regenerative everywhere. Recombinant growth factors like RHPDGFBP and RHFGF2 shows evidence for enhancing bone and soft tissue regeneration. Enamel matrix derivative proteins like endogain remains a commonly used biological for root coverage and regeneration. Recent studies explore combination therapy. So can you see this diagram? This where modified papilla preservation technique, simplified papilla preservation, single flap approach, entire papilla preservation, modified single invasive surgical technique and minimally invasive surgical techniques. So biomaterials like guided tissue regeneration, absorbable, non-absorbable and guided bone regenerations where novel bone substitutes and 3D print scaffolds enable patient-specific grafting and improved handling. So focus on bioactivity, space maintenance and infection resistance. So this is the one clinical study where we can see the regeneration using GTR and GBR membrane. Lasers and adjunctive therapies like erbium, YAG, diode, LENAP protocols can be used. Low-level laser therapy mainly aid in healing evidence. Digital imaging, CBCT, 3D planning, improved diagnosis, guided surgeries. So patient's blood can be drawn from collection of antecubital fossa, centrifuge blood supplies where can get a plasma buffy coat and the erythrocyte. This is the upper part, acellular plasma cells layer and the platelet rich fibrin and the RBC layers. So stem cells like periodontal ligament cells, bone marrow, mesenchymal stem cells, cell-free exosomes. So these are the choose technique based on defect morphology, patient factor, clinical expertise. Maintain strict infection control and pain oral hygiene. So clinical relevance like understanding the surgical anatomy is critical for periodontal surgery. It helps prevent damage to vital structures, guide flap designs, incisions and healing outcomes. So conclusion, periodontium is a complex integrated system. Preservation of structures ensures long-term oral health. Knowledge of anatomy aid in effective surgical interventions. These are the references.